website to educate us all on rheumatoid arthritis. It turns out I didn't know much about it, and I have a connection to RA that I'll get into in a bit. But to start off, who's heard of RA? Show of hands. Does everyone know what it is? No. You know what it is?
Decently well, yeah, I think.
Okay, in 2 words, how would you define it?
Autoimmune inflammation of joints.
That was more than 2. But thank you. No, that's good.
Autoimmune, you can hyphenate.
Yeah.
Autoimmune is 1 word. Actually. It's 1 word.
Oh, okay.
So it's an autoimmune disease, right? So your body attacks itself. So when I recognized, while I was trying to figure out what I wanted to talk about for my presentation, I realized that, so my mom has RA, and I just haven't understood it well for a long time now. And so it's kind of been a significant hindrance in her quality of life. So I decided that I was going to make kind of this educational hub for resources on what RA is. So we're going to talk about what it is, common symptoms, how it's diagnosed, how it can be treated, and then really what kind of inspired me is the complications that RA can introduce to somebody's life. So we'll start with what is RA. So.
Is my internet off again? Okay. Oh, because Braden closed my computer. Don't close my computer.
It was a mic drop moment.
It was a mic drop moment, yes.
Yeah, sorry.
I just didn't drop your laptop instead.
That's good. I don't know why it has such trouble. I have to do this like 3 or 4 times before it lights.
Oh, it's just an issue with the Wi-Fi. It always happens to us on a piece of meat.
Okay. Now you should be.
Awesome, thank you. Okay, so like Braden said, it's an autoimmune disease and it's inflammatory. And it primarily attacks the patient's joints. It's seen most often in the hands and the wrists, so small joints. You can also see it in elbows, knees, hips, and feet and ankles. But what happens is that it's a disease where the body starts to attack itself. It thinks it's fighting off an invader, but instead it's just attacking itself. And we can also see that it could lead to complications in organs like the lungs, the hearts, the eyes. So I got these from a Johns Hopkins rheumatology video that I was kind of using to educate myself. And so what happens is that your immune system is attacking the lining in your joints called the synovium. And so the synovium becomes inflamed, which is what we see in the picture on the right, and that can lead to the destruction of cartilage and bone in your joints. And that can't be reversed. Once that damage is done, it's kind of done for good. So that can actually lead to deformity in parts of your body, like in your hands, like we see here. And that can significantly hinder your quality of life if you start to have difficulties even carrying a milk jug. I'll get into what I was going to say. I'm just getting ahead of myself. What we see is pain and ache in the joints. It's like a stiffness and a tenderness. A lot of times they're swollen. And like I said, the smaller joints are affected more. Typically, it's a bilateral disease, so you'll see it in both hands, both knees, both elbows, so on and so forth. Patients who are diagnosed with RA might be concerned with weight loss. They might experience fever. And there's like these flare episodes that can occur when the swelling, the pain, and the ache seems to be much worse than it normally is. Besides symptoms, there are risk factors that can kind of put you at a predisposition to onset RA. So that likelihood increases with age. We also see that it's 2 to 3 times more common in women than in men. And there's the human leukocyte antigen class 2 gene, where patients who have positive genotype have an increased risk if their environment happens to be smoky or if they're obese. So the gene doesn't actually predispose you to RA directly, but if you happen to be in an environment where perhaps you're obese, or if someone in the household smokes, or if you smoke yourself, that can increase your chance of developing RA. Some interesting ones that I thought is that women who have never given birth tend to have a higher risk of developing RA. When I shared that with my mom, she told me that she should be fine then. She's had 4 kids. And also, breastfeeding infants tends to decrease the risk for the mother to develop RA. Like I mentioned earlier, the risk of going untreated and kind of pushing it under the rug is you could lead to deformation of your joints. And because there are so many symptoms and so many complications, it's actually difficult to diagnose RA because any combination of symptoms could show up in one patient. And so a lot of times the trick for diagnosing patients is ruling out every other possible cause to the symptoms they're experiencing. So a physician would start with a physical exam. First they'll take health history, hereditary and family history, kind of how long have you been experiencing pain and swelling, what has that been like, and has it been inhibiting your quality of life? And then they'll do a joint count examination where like, they take your hand and they kind of press around all the joints. A lot of times in moderate to severe cases, they could feel the amount of inflammation and the swelling in your hands. And so they'll check those most commonly impacted joints. The pain and the swelling are not mutually exclusive. So it's not like one or the other, obviously, but you can experience one without the other. So that's part of the trick to it. You could be experiencing pain in your hands, but they're not detecting any swelling when they do your joint count exam. There's also a lot of factors and indicators they can pick up on when running blood work. There's the rheumatoid factor. That's an indicator. About 75% of RA cases are RF positive, but the issue is RF is not exclusive to RA, so you've got to find some more indicators to check out. So there's the anti-cyclic citrullonated peptide antibody, or anti-CCP, and that's more specific to RA, and high levels of anti-CCP are correlated with a more aggressive case of RA. And I made a note here that not all RA cases are RF or anti-CCP positive. There is the case of seronegative RA. My mom is actually seronegative, and that means that her RA has been diagnosed on symptoms alone. Her RF and her anti-CCP are of normal levels. So that actually will be an indicator. But there's the erythrocyte sedimentation rate, which measures inflammation, and the C-reactive protein, which also measures inflammation. All of those tests or levels can be derived from blood work tests. Finally, they can run x-rays, and what's super helpful actually is ultrasound imagery can detect small amounts of inflammation that a physician wouldn't be able to pick up on during a joint count examination. So there's a slew of complications that RA can lead to, and this is actually the kind of the inspiration for this project. In late February, my mom was hospitalized, and they determined that it was a respiratory failure, but not really sure what happened. So early in February, she had pneumonia, and so late in February, she ended up being hospitalized, and they weren't sure exactly what happened. And so there's kind of been this mystery that's been unfolding for the last 2 months. Is it cardiovascular? Is it pulmonary? She was sent home eventually, actually just towards the beginning of spring break. And she's been on oxygen until last week. They finally picked up those supplies. But I felt compelled, after seeing her at home on oxygen, to better understand kind of what's going on. And there's been a big conversation about perhaps drug interactions or a drug that she was taking might have opened the door for something else to really wreak havoc. So RA can lead to issues with premature heart disease, obesity, osteoporosis, rheumatoid nodules. You can see things like abnormal body composition, carpal tunnel syndrome, and then what got my attention was the heart disease and the lung disease, especially because my family has history with that on both sides. And like I mentioned before, if it goes untreated, it can lead to a real issue with quality of life. You could put yourself in a position, if you don't treat, where you wouldn't be able to work. And in extreme cases, you can't even manage yourself around your own home because you just can't. You can't open doors and you can't handle jugs of milk. But there are a ton of ways to attempt to treat RA. The first Band-Aid solution is corticosteroids, which is prescribed by your primary care physician. And there's major side effects to steroids. Most notably, you see swelling like in the face and in the hands. But once you finally see a rheumatologist, you'll start with the DMARD. And so the most common one is methotrexate, which many of you have probably heard of. And that's actually the drug they think was the culprit for my mom, so they've cut that off for now. But the DMARD that's prescribed is based on the level of RA, the severity. and methotrexate is the most commonly prescribed. And I believe it's also used in some cases as a primary treatment to some cancers. A biologic is the next step, and that's a protein that's synthesized in cells, and it's made to target the inflammatory cycle. So that's where we start to see like tumor necrosis factor, which we've talked about. So these TNF inhibitors will keep TNF from sending its signal, which says, hey, we need to produce more inflammation here and fight this invader. And it's the first biologic that was approved for RA treatment, and it's usually the first stop that rheumatologists will take. Those are drugs like Humira and Enbrel. And all biologics are administered either through injections or through IV drips. There are interleukin-6 inhibitors. TNF and interleukin-6 are both present in the inflammatory cycle. So if you inhibit those signals, you can start to decrease the inflammation being experienced in the joints. There are T-cell co-stimulation modulators, which will block the T-cells from receiving messages, and that'll bring down inflammation. And then rituximab will deplete or lower B cells and start to shut down the immune system around those affected joints. Even more interesting, so we're kind of seeing bigger steps taken as we go down the list are Janus kinase or JAK inhibitors. And so they signal with cytokines in the inflammatory cycle. And the goal is, again, to interrupt that signaling. So they act like biologics, because we see that biologics, the TNF inhibitors, the IL-6 inhibitors, they're blocking inflammation cycle. It just so happens that JAK isn't a biologic based on the fact that it's not produced in cells. And those are oral drugs that are taken once or twice daily. And then finally, this isn't a severe step, but there are things you can do to manage your own quality of life, getting better physical activity, refraining from smoking or stopping smoking, maintaining a healthy weight, and then there's self-management education. So meeting with your rheumatologist to talk about what you can do to better treat yourself at home and kind of maintain a manageable quality of life. So I just wanted to touch on a couple of key things that are worthy of mentioning as it relates to the class. So inflammation, we know, is how our body fights invaders, but in autoimmune diseases like RA, we see that the body is fighting, is shadowboxing an invader that's not present, so it starts to attack your own body. And that can, like I said, lead to damage in the joints. So cytokines and Janus kinases are two of the substances present in kind of the fluid of inflammation. And so what JAKs do is they mediate cytokines. They both send signals in that inflammatory cycle, which continue to, it's like a positive feedback loop, essentially. Macrophages, fibroblasts, and osteoclasts are also present in inflammation, and they're actually the cells that do the damage to the joints, the bones, and it can even lead to weakening in the tendons and ligaments, which continues to weaken and deform body parts. Finally, tumor necrosis factor, which I talked about, it can actually act as an adipokine and a cytokine. And so when acting as an adipokine, it promotes insulin resistance, so that we can start to see an onset of type 2 diabetes. And when it is acting as a cytokine, like I said, it will kind of trigger macrophages to detect that infection. The macrophages will detect that infection, and they'll release TNF to trigger other immune cell responses to the inflammatory cycle. So, I have this link shared to Dr. Beck, so she could post it on the Blackboard if you ever wanted to find yourself perusing it. But really, my top sources were Johns Hopkins Rheumatology, the CDC, and the Mayo Clinic, and they had a lot of helpful resources to read through while I was putting this together, and videos to look over. So I guess what I found through all this is that RA can present itself in very different ways. If it goes untreated, it can lead to a severe decrease in quality of life. And really, like, when you encounter someone who's going through something like this, it's probably a lot worse than it seems, because they're probably managing with a lot of drugs and a lot of other ways to manage at home. So, thank you.
Did you see anything about how maybe there was some initial triggering infection that does then lead to this kind of immune response? Is that ever?
I actually didn't include this. I should have. I had everything typed on a Word doc when I was doing my research, and I used that to build the website. There's actually not a lot understood about what onsets RA. There's a big genetic factor, but they don't know exactly kind of at what point the body says, I'm going to start responding to this thing that's
Yeah.
not there.
Because some people get it really young. I had a friend that was in her 20s, I think, when she
Yeah.
got rheumatoid arthritis. We think of it as old people disease, but I
Yeah,
just...
typically. Yeah, usually the bulk of people will start to see it in their 40s and 50s, but
Yeah.
some cases start young, and that's like what's terrifying about it is like if it's not managed well, you like the damage that's done is irreversible. It's like when you see deformity in the hands, like they're not going to come back to normal. So I
Not
also-
yet, right?
Right, not yet. Not until the tissue
build
damage finds a way to be
cartilage.
repaired. I also, what's interesting is when I was digging around kind of some literature when I was trying to troubleshoot as someone who doesn't even have a bachelor's degree with my mom about like what could be happening, and there's some research out there right now actively being done in clinical settings about RA, its relation to pulmonary diseases and cardiac, and so like it's kind of like not helpful that both of those things could be possible because it's like that
Just more problems.
reiterates the mystery of what happened in February.
Right. Well, thank you.